Alright, this is managing diabetes while sick. I got the handout here. It's important to manage our diabetes when we're sick because when you're sick, it can kind of throw your blood sugar out of whack. It can make it more unpredictable. It can either spike or drop. Most cases when it drops, it's because you have decreased appetite, or when you're spiked, it's because you're fighting off some inflammation. But yeah, anyways, battling that illness puts stress on your body, and then your body can release hormones or different things to conflict the illness, but it can also have an effect on your blood sugar, either raising it or lowering it. You want to always make sure, the first rule I would say is to make sure to continue your medications. I mean, it's not going to do any good if you're not taking them. You got to take the insulin you're prescribed and the other drugs that you take to manage your blood sugar, just because those are there to manage your blood sugar. If you're not taking them, it's going to throw it out of whack more. And then your body needs the insulin, especially at this time, to allow glucose to be used by your cells to lower that blood sugar if it's high. And then call your doctor if you have any questions, because it's better safe than sorry. But a general rule of thumb, keep taking the medications that you're prescribed when you're sick, unless instructed otherwise by your provider when they put you on those. You want to make sure the second rule is to make sure to check your blood sugar more often. It's recommended to check your blood sugar every 4 hours. More wouldn't hurt, but every 4 hours is a good rule of thumb. You want to keep a log of your numbers to track trends, to see, is it trending up, is it trending down, is this your normal baseline? Just to have a general idea where it's going. But if your blood sugar is above 250, that's probably too high. If it's below 70, it's probably too low. Above 250, you might want to try some interventions to lower it, insulin or medications, or whatever your provider has told you before. And if you have questions, call them. And then if it's low, try eating something to get it back up. Make sure the third rule, make sure you have enough fluids. You want to consume about 8 ounces every hour. And then best fluids to consume are water, broth, sugar-free sports drinks, or sugar-free juice, just because those usually are low sugar. They won't make your blood sugar spike. Yeah, those types of fluids are usually the best in most cases. But if your blood sugar's low, it might be okay to have something with sugar. If you did a sports drink with sugar, or a juice with sugar, in a small amount, to not make it spike too much. That's good to have on hand, but just as a general rule of thumb, like, you don't want to spike your sugar, so typically something that isn't high in sugar would probably be best. And then if you're feeling nauseous or unable to eat or drink fluids, then yeah, you can try some fluids that contain sugars, but make sure to not overdo it, like I said a little bit ago. And then if you're going to do that, keep a close eye on your blood sugar, because yeah, you don't want to spike it. And then the next rule is to try to eat if you're able. And then there's a couple of things that are best to eat when sick. Those are soup, crackers, applesauce, toast. Those usually are safe because they won't cause a huge spike in blood sugar, but try to eat small meals if you're feeling nauseous or unable to eat. Small meals every few hours. And then the next rule is to be aware of the signs to watch for, and then call your provider, let them know if it's something that is concerning you, or you have questions about. Some of these signs are if your blood sugar's over 250 throughout a 24-hour time frame, if you're not if interventions aren't working, if you're vomiting or having diarrhea throughout a 6-hour time frame, that can cause really low blood sugar. If you have a fever at 101, probably a good sign to call the provider, just because that could get worse. If you have trouble breathing, dehydration in your mouth, or if you have dizziness, make sure to call your provider. Let them know what's happening. And then the next rule is to watch for ketones. It's important to check your ketones if your sugar's high. You can use a urine test strip to do so, and then call your provider if ketones are present. And ketones are your body's not being able to use the glucose, so it's resulting to use other things like fat or muscle or protein, and then ketones are the waste from that. But your body should be using glucose if glucose is there. And then you want to seek help if you can't keep your fluids down. That can cause dehydration, other things down the road. And then if you're feeling confused or abnormally weak, you should seek help. And then if your blood sugar's high, over a extended period of time, go ahead and seek help. But yeah, that is the sick rules for managing diabetes while sick, and some things to watch for, and yeah.